We don't think of technology as being able to reach inside of a situation that is so intimate, so human, so vulnerable, and being able to give back something that really is so affirming. That's one of the potentialities of the Canadian Virtual Hospice.
For me, the questions really started when we realized that my mom wasn't going to make it through. The doctors, we felt, were always trying to intervene and trying to get her to get better. But as soon as the shift went from getting better to being comfortable, that is when it was like, oh my goodness, we have not traveled down this road before.
Each of us, and it doesn't matter who we are or what we think of ourselves or how impervious we think we are to troubles coming our way, all of us at some time or other are going to feel vulnerable. And I think it's pretty fair game to say that none of us feel more vulnerable than when either we or someone we love is facing a very serious or life-threatening or life-limiting condition.
What do we do? What do we say? What does my mom need? And so the biggest questions were, how do we get through this? How do we survive?
The Canadian Virtual Hospice is a safe place for people to find information at a very difficult time in their lives. Whether they're a person who is dealing with the fact that they are dying, whether they're a family member that's recognizing that somebody in their family is having significant health issues and will not be in this world much longer, or if they're healthcare professionals who are dealing with patients or scenarios that they are having a very difficult time with.
When I first visited the website, it was, wow, this is amazing. It's very easy to navigate.
In my mind, this is perhaps one of the most potent interventions, if you will, that we can offer. Ask a Professional, even though it looks very simple, really allows people, patients, families, healthcare providers, volunteers, to pose a question to an expert in palliative end-of-life care.
My main role with the Canadian Virtual Hospice is to provide responses to the questions posed in the Ask a Professional area. And also I provide some of the online content that people can look at and use for information to some of their questions.
How we respond to people, that we are appropriate in what we do, that we provide them with enough resources so that they can also access information. So we work quite closely.
One of the more touching stories that I recall from working on the Ask a Professional area of the Canadian Virtual Hospice was that of a teenager whose parent was just diagnosed with an acute malignancy, an acute cancer-type illness. The question that was posed on the Virtual Hospice site was how to help the other parent, because the other parent just didn't seem to be handling the information well, seemed to be falling apart. Why would she go to this internet site to seek support about something so important, so powerful, and really so devastating for her family? But I would ask you or others, where else would she turn?
The bulletin boards offer a variety of different topic areas, such as Just Want to Talk, or talking about pain issues that people may have. Families and friends have linked really well on the different bulletin boards and provide support to each other through this. It's also a great aspect for healthcare professionals who can link and discuss clinical issues that they may have or interesting information on different medications that they would want to share with others. This website makes things a bit special because people are asking really complex, heart-wrenching questions at times that they're dealing with some very difficult issues in their lives. We're able to respond to them in ways that's a little bit different because we don't know who they are, and sometimes that anonymity actually makes it a bit easier for them to ask questions that they wouldn't necessarily ask from others.
I think the biggest need is for clear, honest information.
If it's a late some evening or early in the morning and the questions start to arise, that's the time that you might go online. That's the time that you might find yourself in front of the screen that says Canadian Virtual Hospice.
Walking with somebody that you love and care about through their last days of their lives is probably one of the hardest things that one would have to go through. And the website can help ease that period of time. That's invaluable for people who are suffering.